Will we see mandatory mask enforcement in Saskatchewan? For more on this, I'm joined by Dr. Ann Huang. She's a former Deputy Medical Health Officer in Saskatchewan and oversaw public health programs in the province for the past 5 years. Dr. Huang, in your opinion, should we be following the lead of other major cities and have mandatory mask bylaws for indoor spaces?
At this time, I think it's a prudent thing to do if we want to re-flatten our curve again without significantly compromising the level of economic and social activities that we have been able to reopen so far. We learned recently that the effective reproduction number is 2.2 for the Saskatchewan COVID-19 epidemic right now. And that means that the epidemic curve is no longer flat. And if we continue with the current level of interactions, we will be seeing exponential growth of our cases. But there's a lag time, so we won't see the effect of current transmission level until 2 to 3 weeks later, and with further delay of hospitalization and ICU and death lagging by about a month. So by the time we see that rise, that will be the start of the school year, and that will be a bit late for us to catch up then. So I think if at this time, with the rising cases, not just in certain communities, but overall, the rising proportion of community transmission has been observed, a mandatory indoor mask policy will help Saskatchewan contain the current outbreak and reflatten the curve.
Through the pandemic, information and science behind it has evolved. At one point, we were told we didn't need to wear a mask, just for example. But what do we know now about transmission when it comes to aerosol versus droplets?
Now, the confusion lies in what's considered to be an aerosol by medicine and by engineering and physical scientists, aerosol scientists who study them. And so, by definitions, aerosols are anything that could float in the air, so it's airborne. However, the definitions and what's been learned is that not just respiratory emissions that are less than 5 micron in diameter can float in the air. So in fact, when we speak, when we breathe, and even more when we sing and cough or sneeze, we're emitting a large amount of various sizes of respiratory microdroplets and larger droplets. So it's not a black and white cut of droplet that's larger than 5 micron versus aerosol that's smaller than 5 micron in diameter, as we've been told. And that dichotomy is actually based on science. It's quite outdated now, since the 1940s. So that's why we've heard scientists who've wrote a letter to the World Health Organization urging them to look at the evolving and existing scientific evidence on what happens with humans' respiratory emissions. Is that, in fact, these smaller sizes of respiratory emissions are actually most abundant near us. And they could hang around in the air for a few hours and remain viable. And further studies have shown that surgical face masks, traditionally used as part of the what's called droplet precaution in hospital setting, can actually filter out tiny droplets, even smaller than 5 microns. And so it's a bit complex, but what we know now is that the face mask, the surgical face masks can definitely protect us from portion of the aerosol, traditionally considered to be aerosols by medicine and infectious disease physicians or infection prevention control specialists. But what's more surprising is even homemade fabric masks based on US CDC standards can actually have some effect for the wearer, not just to reduce the emission from the person, from the source. So I think we actually have very strong scientific evidence to adopt this low cost and relatively harmless interventions to help us stop the pandemic.
Very, very interesting stuff. Thank you so much for your perspective and your research today.
You're welcome.